Before we begin the meeting, some housekeeping notes. The capacity for this meeting is 300 call-ins, so we do have 159 people in already. So with that amount of people, to minimize the amount of background noise, you are being muted when joining the meeting, and we ask that you do not unmute your microphone to keep down the noise. Tonight's virtual event is an educational presentation for the Lana'i community to better understand the COVID-19 contact tracing process, which I'm sure everyone is interested in right now, and community infection prevention. Regarding questions that you might want to ask on the topics being presented tonight, due to the high number of participants and to avoid confusion, instead of asking questions verbally, we are asking that you are able to please go ahead and use the chat feature, which you can find at the bottom of your computer screen, and you can type in any question you might have about tonight's topics on the screen. We do have someone monitoring the chat, and so after the presentation, frequently asked or very pertinent questions in the chat will be given priority and answered at the end of the presentation, time permitting. To respect everyone's time, this virtual event will conclude no later than 7 p.m. If for some reason your question is not answered tonight, you may also email your question to the Department of Health's Maui District Office at doh.maui-triage@doh.hawaii.gov. This email address is listed at the, well, it's not listed yet, but it'll be listed in the chat feature, so you can find it there, and it'll also be provided at the end of the presentation. Your email will be answered, but please do be patient, as our Department of Health is, as you might guess, quite busy right now. So thank you for that. And just to let you know, tonight's presentation is being brought to you by your Lana'i Emergency Preparedness Group, medical sector. This comprised of representatives from the County of Maui Department of Public Health Nursing, the Fresenius Kidney Care Lana'i Community Dialysis, Lana'i Community Health Center, Community Hospital, Lana'i Kino'ole, Hawaii, and the Straub Medical Center Lana'i Clinic in partnership with the Maui Police Department Lana'i District. I want to thank our Zoom site host, John Medeiros, and the Lana'i Community Health Center for helping us put this together. And now let's go ahead and begin our meeting. Again, one more reminder, please mute your microphone to minimize the noise. If in order to do that, there is a picture of a microphone at the bottom left hand of your screen. Please click on that to make sure that it cannot be heard. We still have some open mics. Please check to make sure that your microphone is turned off.
I think so. The moderator can automatically mute everybody.
All right, thank you. Without further ado, let me introduce our guest speakers for this evening. First of all, Dr. Lauren Pang, our Maui District Health Officer. He has been a warrior for us all throughout 2020, working to help keep the County of Maui and Lana'i safe throughout this crisis. We also want to welcome Ms. Heidi Taogoshi, Maui County Public Health Nursing Supervisor. You may not have heard her name as often, but she's the boots on the ground and has been working tirelessly with our medical sector on the island of Lana'i, making sure that everyone is networked and connected and has information. So Dr. Pang, Ms. Taogoshi, welcome to both of you.
Okay, thank you. Hello to the people of Lana'i. Last time I was there was Zika, but that's not person to person, so we can go personally for that one. That's person to mosquito. Okay, So today's topic is, what is COVID-19? What can the community do to prevent the spread? Now, there's some new things we learned. And what is the Department of Health doing to control the spread? So we do different things a little bit than what the community does. We do our part, you do your part, and we do it together. Okay, next slide. I'm not going to read the slides. You can read them on your own, but I'll just kind of highlight a few things. Okay, first of all, what is COVID? It's a virus. It's a class of viruses called coronaviruses. And COVID stands for coronavirus disease -19 because it came out in 2019. All coronaviruses, and there's maybe 30 that we know about, they all come from the bat. And we found this out about 10 years ago. The bat has some coronaviruses ready to come out. And generally they come out into animals first, mammals or birds. And after maybe 10 years, 100 years, 1,000 years, 10,000 years, they mutate in those animals and they jump to humans. So once in a while, it might come directly from the bat, but more than likely, it came through an intermediate mammal mutating. Okay, so the one in 2019, they think it came out of this animal. It's called the scaly anteater. And some people, oh, there it is on the slide. It's called a pangolin. I am really upset about that. I'm Dr. Pang, and that's the pangolin. And so I always will say, that's controversial. You haven't proved it's from the pangolin. And more, it looks like it's not from the pangolin, but I won't tell you about where it's from. That's speculation. Now, before this coronavirus came out, there were two more. One came out in 2003, coming out of the civet cat. It's kind of like a raccoon that climbs trees. It originally came from the bat, but I don't know how long it was in the civet cat until it jumped into the civet cat owners and spread human to human and throughout the world. And there was a big outbreak because people from Southeast Asia who got it somehow linked it and spread it to Toronto, Canada. That was 2003. Then 2015, well, 2012 to 15, another coronavirus came out of the bat. The intermediate animal was the camel. So that was called Mid-Eastern Respiratory Syndrome. So it jumped out, and it's still going around seasonally in humans from camels and humans. Okay, so that's the source of this, and they are speculating that this COVID-19 came out around January, let's say December 2019, in Wuhan, China. That was the wet market, like game meat, and they are pinning it on the poor pangolin. There he is, but it might have been from many other sources as well. In the meantime, you know as well as I, it has spread out of Wuhan, China, and there's millions of people infected worldwide. I think like 500,000 or more than 500,000 deaths in all continents, et cetera, except Antarctica. Next slide, okay. So that's how it came to be, where it came from. But now that it's jumped from, okay, say the pangolin into humans, how does it spread human to human? This virus, it lives in the respiratory tract of humans. Your throat, here's your respiratory tract. Starts with your nose, your mouth, your throat. By the way, your nose, you see that little picture? Your nose and your mouth are connected to your throat. A lot of people were not wearing their mask and they were not covering their nose. Now, if you tell them, hey, how come you're not covering the nose with your mask? They didn't think their nose was connected to their throat and to their lung, the rest of the respiratory tract. But a lot of people said, no, your nose is connected to your throat. So it was a little bit interesting that a lot of people didn't know that, and then they quickly put on the mask to cover their nose and mouth. In case you actually get asked that, I remember real easily. I have two daughters, and they were young, and they were playing with this funny spaghetti game. See if you can swallow the spaghetti noodle without chewing it. So one of them swallowed the noodle like a foot long. The other one made her laugh. And when she laughed, the noodle came out her nose. And everybody was shocked, including them. But I knew that. I knew the mouth was connected to the nose. So I just said, get that out of your nose. And that's that. Now, we're all connected. And this virus likes to live in your respiratory tract, or it infects it. And from there, it spreads anywhere in your body. Your brain, your lung, your kidney, your muscles, everywhere. But it initially gains access through your respiratory tract or your mucous membranes. That's a second thing. Your mucous membranes are anything on the body that's kind of wet. Your mouth, nose, eyes, not your ears. Your tongue is mucus. The inside of your lip is mucus. And then you have the genital area. That's mucous membrane. But we don't spread it like coughing or breathing into the genital area. That's another set of diseases, okay? Hepatitis B, HIV, et cetera, et cetera. So this one can go directly to your mucous membrane, like someone coughed, someone spoke, someone sneezed, in droplets. These droplets, what does that mean? A little speck of mucus, a little speck of spit that's contaminated with virus. How long does a droplet move? About 3 to 5 feet. Okay. So if I shout, it might go to Heidi, but she's wearing her mask, right into her respiratory tract if she takes a deep breath. We have learned that it really is spreading not by big droplets, but by fine droplets, which can go 6 to 7 feet. Then we have learned it goes to fine, fine droplets, which can go 10 to 12 feet. So it's spreading farther and farther the more we know about this. We have promised everybody we will not call it airborne. True airborne diseases like measles are not little droplets. They just float on the air. The viruses float on the air and they'll go like 28 to 30 feet. We are trying not to say this is airborne, but yet it's smaller and smaller and smaller droplets. So they might use the term aerosolized, whatever it doesn't matter to me. The size of the droplet's a continuum, and yeah, it spreads 10 to 12 feet now. Okay, so that's how it's spread out. When you cough, sneeze, laugh, speak, sing, and some people say just breathing, and some people say shouting. If you shout, it just goes out farther, much farther. Now, the other way it spreads, the fomites, right, is when my droplets touch things. I think we can go to the next slide because you have a picture. Oh, we'll cover that later. My droplets, might touch things. And on the things, it can survive in air-conditioned temperatures, maybe 1 or 2 days. And when Heidi touches the thing with her hand, now it's on her hand. And believe it or not, people touch their face 1,000 times a day. And from her hand, it can enter any mucous membrane, the eyes, inside of the nose, inside of the lip. And so some people on their hands push it in their face because my droplets spread all over the place. In Hawaii's ambient temperature and no air conditioning, those virus particles will probably live 5 or 6 hours. In air-conditioned temperatures and humidity, maybe 1 or 1.5 days. So don't turn on the air conditioner unless you really, really have to. Now, then you get the disease. You're inoculated. You got it. Well, now what happens? Well, between 2 and 14 days. Hey, that's a big time span, man. I thought it was like 3 days. Well, it's average 4.5 days, but it could be variable. Between 2 and 14 days, you're going to grow this virus, and then you might get sick. Some people never get sick. But if you get sick, you will have all these possible symptoms. Hey, that's too many to remember. We started off with 3. Let's see if I can remember what they were. Fever, shortness of breath, and cough. Those were the classic 3. Since then, we have all these other ones. headache, diarrhea, nausea, vomiting, etc., etc. In fact, some people, you see that mid one down, unusual fatigue, generalized weakness. Hey, that's me every other day. No, I'm joking. Okay, but the bottom line is a lot of people were shedding the disease, and when you ask them, were you sick? Did you have fever? No. Cough? No. Shortness of breath? No. Well, what did you have? Nothing. And then we found out they spread it. And we went back to them and said, come on, you must have had something. And they said, you know, I just wasn't feeling right. Yeah, what does that mean? She said, jet lag. Okay, so if you're not perfectly well, I guess you could still spread it. A lot of people, probably half the people, spread it before they even get sick, 1 or 2 days before you get sick. Some of the people spread it without getting sick ever. Whoa, whoa. So children, let's say less than 5 years old, I would say 75% of the children who get infected never get sick. With adults, it's the opposite. 75% get sick. Okay, next slide. So that's the symptoms. So knowing that, how it spread, what is symptoms and all, how are we going to prevent this? So on Maui, we stole a few things from the federal people. They call it the 3 W's, okay? What's one? Watch your distance, number 3. That means don't get within 6 to 10 feet of somebody else. Whoa, especially if you don't have a mask. Even if you do have a mask, I think you should be a little bit extra cautious. And if you can avoid getting close to them because of their fine droplets, don't. Now, next W, wear a mask. Oh, we'll talk about that later. Next W, wash your hands frequently. Because you remember it's on your hands because you touched the contaminated surface. So those are the classic 3 W's. And we added 2 more on Maui. And I think it's okay. I didn't clear it with the guy who said this. One is wellness. Don't go out if you're sick. If you go out in a group and the other person's not perfectly well, just politely say, I think I better be going home. You look sick. No, just kind of back off, say what you have to say, and kind of, you might say, can you put on your mask, or you put on the mask, but keep your distance if all of a sudden they appear not too well. Next, wipe off and disinfect frequently touched surfaces. We'll talk about each of these later. Okay, here's how to wash your hands. That's one of the W's. It's not in any order, okay? Wash your hands. You can read it. Well, that's a lot of hand washing. Yes, but the more stuff you touch that other people touch, well, wash your hands more, okay? Especially if it's going near your face. How's it going near your face? When you eat, don't forget, we all touch our face 1,000 times a day. When you adjust your glasses, when you move your mask around, hey, okay. And especially when you cough or cover your nose and all that. How do you wash your hands? It's nice if you have soap and water, but if you don't have soap, can you just use water? Okay, hand sanitizers do work. You are lucky. This virus is sensitive to hand sanitizer. There's some viruses that are not sensitive, but we won't talk about that now. Use the hand sanitizer. Don't use the one with methanol. That's a toxin that can go through your skin. A lot of people made that because I guess it's cheaper. And then how do you actually wash your hands in soap and water? You gotta wash it for, there it says, right, 20 seconds. Now that's hand gel. But when you wash your hands, you're supposed to do it 15 or 20 seconds. How do you do that? So we tell the kids in elementary school, you can sing happy birthday 3 times. That's about 15 seconds. After a while, everyone's going crazy because these kids are shouting happy birthday. You can sing A, B, C, D, 1 time. That's about 15 seconds. And that should be enough. Next, mask. Oh, now this is very important. There was a time a couple months ago where the feds, the authorities say, don't wear a mask. Whoa, don't wear a mask. Why not? because the general public was using the mask for the medical people, and they were short. So they told the general public, don't wear mask. Okay, next, the public started making their own mask. And the Fed said, wait, don't wear a mask. Why not? They're not that effective. And it's a false sense of security. What else? Don't wear a mask. It doesn't fit. And you keep touching your face to make it fit. And you smear the stuff in your eye. Well, all of a sudden, about, I don't know, 6 weeks ago, a guy from Harvard, Dr. Feinberg, said, wear the mask, because everyone's spreading it when they talk, when they breathe, when they shout, when they sing. Everybody's spreading it. So many people aren't even sick. They're before they're sick or never get sick at all, and they're spreading it. So since everybody's out there, everybody wear the mask, even if it's not the great one that the medical guys use. And Dr. Feinberg, as soon as he put on his mask, he said, hey, watch this. I go outside and he takes off his mask. And he says, outdoors, the ventilation is so good that if you're not within 7 feet of another person, you can take off the mask. You will see repeatedly the regulatory agency says, everybody wear a mask. If you're outside your house, wear a mask, wear a mask. That's a little bit overkill, but because some people don't get the message to even wear the mask at all, we had to make this mandatory thing where everybody wears a mask outdoors. On Maui, we're trying to just be a little sensible. If you're outdoors and you're far away from other people, you can be with your own family, and you're like, you're 10 feet away from the other guy. All right, don't have to wear the mask outdoors. There, I said it. Surfers, when they get together, they can't wear the mask, you can't breathe. Well, use some common sense. But flotillas, whoa, that's outdoors, too close, wear the mask. What did we learn about the mask? You see on the left-hand side, there's a guy wearing the mask. All right, you see that middle picture? The guy who puts on the mask blocks about 90% of his germs. Whoa, okay. But we always said, see the top picture? The woman wears the mask. We always said that it did not protect the wearer from other people. It protected you from spraying it, but if you were wearing the mask, it didn't protect you from other people. We said it only protected you 20%. Well, that got fixed. That's that first red arrow. It doesn't protect the wearer 20%. It protects the wearer 70%. Wait a minute. You mean you used to say it protected the wearer 20% and now it's really 65 to 70%? Yep. So the mask is really that effective if you put it on, not only blocking what comes out of the guy, but protecting what the woman wears. So the lower picture, it's blocking 90% of what he emits, and it blocks 70% of what she breathes in. Some of the vaccines we use against viruses are not 65, 70%, and we take the vaccine. Well, here's something as good as a vaccine, the mask. Until we get the vaccine, put on the mask. Now remember, that's not the N95 mask. That's a cloth mask that you see everyone wearing all over YouTube. And for Pete's sake, make sure you cover your nose, because your nose and mouth are connected to your throat. So the mask is very, very effective. Next slide. Watch your distance. Okay, that's pretty clear. How far apart should we be? 6 to 10 feet. Okay, so if you're going in a big crowd and you try to keep 6 to 10 feet apart from everybody, can't do it. So just don't go in big crowds. Even if you get within 6 to 10 feet, can you please wear, well, if you're in 6 to 10 feet, can you please wear a mask? Can you make sure the other guy's wearing a mask so you get the double protection? You protect him from you, and you protect yourself from him. Okay, next. Now, those were the 5 W's. Somebody says, well, let's just go with the 3 C's. I don't like the 3 C's too much. That's what you don't do. Don't go into closed spaces or ventilation. Yep, Dr. Feinberg took off his mask when he went outdoors. Don't go into crowds, too many people. And don't get close to people. That's don't. Well, what's wrong with just the 3 C's? It doesn't say wash your hand, does it? It doesn't say make sure you're well before going out. Okay, so, you know, there's a lot of don't do this, don't do that, don't do that. But it kind of forgot 2 of the W's. Okay, next. Oh, is this me or you? Me. Okay, the other W, washing off surfaces and disinfecting. I did not know. I thought washing was disinfecting. No, washing is wiping off the dirt because the dirt will neutralize your disinfectant, especially if your disinfectant. Remember, many things can kill this germ. You're lucky. And one of the most mild ones I use is Clorox, 1 tablespoon per gallon, clean water. That Clorox only works if the surface is kind of clean. So you wipe off the surface first to clean it, and then you put on your Clorox solution. Well, shouldn't I put more? No, because higher concentrations of Clorox will dry out your hand. Then you got a fungal infection, and you're gonna wish you never had listened to me. So use the mild amount and don't get fungal infections from drying out your hand. Then you're supposed to leave the disinfectant for what, 15 or 20 minutes to act on the germ. I kind of don't pay attention. I just let the thing dry. I put it wet. By the time the thing's dry, it's about 15 minutes, and that's about right. Okay. Okay, routine cleaning. Well, what should I wipe off? Everything? Whoa. The things that are most frequently touched. The ones I like to point out are light switch, yep, doorknobs, well, touched by the public. Sign in, you know, the sign in pens, everyone please sign in. Whoa, that's bad. Hey, we don't even have that. Things that the public touches the most. Now, hey, here's something for you. We go out, I go out my door. I get a separate door that only I use. Okay, I touch it. Hey, sometimes people go out my side door. They touch it. So do I wipe off the door knob? No. Why not? Because it sits for maybe 5 or 6 hours and the germs die. So if somebody touches it and time elapses and the germs die, then don't worry about it. That's not frequently touched. But if people keep touching it every 2 hours, I think you should kind of wipe off those surfaces. So on the buses, everybody's riding the bus, those things that are touched the most get wiped off and disinfected the most. Next, be well. Okay, don't leave home if you're sick. Remember, sick can be very mild, like I think I'm jet lagged. In fact, there were some guys here on Maui, and they came to me and said, you know, I just don't feel right. This is before I told them about jet lag. I said, well, what's wrong with you? I believe you, you're sick. What's wrong with you? And they just couldn't say. They just said, yeah. And I said, what does that mean? They said, and this is true, I hear it time and time again, I feel like I'm having an out-of-body experience. Like, what does that mean? They're kind of out of it, they didn't sleep right, and they feel like they're outside their body looking in. But a lot of people say that to us. And then a lot of people, actually, if you ask, say, I lost my sense of smell and taste. Ooh, that's a biggie. Sometimes it lasts a long time, and sometimes it comes back kind of quickly. Okay, so don't go out if you're sick. But look, if you got to go see a doctor, call ahead of time and tell them, I'm sick. What do you want to do? Handle this by phone? And he might say yes or no. Okay? And watch for other sick people. Elderly don't do well with this. So make sure you don't go visit them unless you're perfectly normal. Okay.
Okay. Okay. So don't go anywhere, Dr. Peng.
Yeah, I'll change places with you.
Because you're going to answer questions. Oh, sorry. Okay, so this is Heidi. So what happens if someone gets sick? So even if everybody follows the 5 W's that Dr. Peng just talked about, nothing is 100% guaranteed. And I think that's what's so scary about this virus, you know, why it's causing this pandemic. So I'm going to talk about what we're doing. And even if you follow all the recommendations and worst case scenario, you do get sick, I'm going to tell you what we're doing to help you. So if, like we said, if you are ill, please seek medical attention. I think the community as a whole, especially social media. We need to work on decreasing the fear and reducing stigma. We know this virus does not discriminate, so we want people to be cautious and be aware and follow recommendations, but we also don't want people to be deterred from seeking medical attention if they are sick because they're afraid of being on social media or being accused of spreading the virus or anything like that. So I think that's something that the community can play a big part in. So this is what we're doing here at the District Health Office. These are just some definitions that are important to know. When we talk about a case, we're talking about someone who has confirmed via laboratory testing. A close contact is someone we identified that came within 6 feet of a case for at least 15 minutes. Contact tracing is the big buzzword you guys keep hearing about. That term is thrown around a lot. But contact tracing talks about the whole process that we use. Big difference between isolation and quarantine that I feel like that word is used interchangeably a lot. But isolation is when somebody is sick. So a known case that we know has the virus and we separate them from other people so they don't spread it. Quarantine talks about limiting the movement of people who had contact with the person who was contagious, but we're going to watch them to see if they become sick. And I just want to point out there's a difference between travel quarantine and quarantine because you're associated with a known case. So that's another question we get a lot, but travel quarantine is overseen by Department of Transportation and Hawaii Tourism Authority. And you guys know about that, right? 14 days, you have to quarantine in your home if you travel somewhere. But again, that's a little bit different than what we do at the Department of Health when we are monitoring someone who is in quarantine because they're a known case or they're a known contact to a known case. So what happens when somebody does test positive for COVID? Our office gets notified of all positive test results. The ordering provider who ordered the test will also get notified, and usually they are the one to call their client and notify them of the results. Our contact tracers then call the individual and begin their investigation and start to determine their contacts. Once we determine who the close contacts are, we also contact them. It's important to know that it's highly confidential. So the person will not be revealed when we start contacting those close contacts, unless the infected person discloses that themselves, to their family or friends. It does help with our contact tracing, but we do not disclose any of that. And then if there is a business affected, we will work with the employer or the business to determine who will need close monitoring and possibly quarantine for 14 days. So again, we would only tell the people within the business that need to know. So it's usually starting from the top down at the highest level, working with them to see, getting a staff scheduled or figuring out who it was a close contact and who we need to notify. So our investigations that our investigators are doing, they're very time consuming. This is what they're working primarily over the phone, but working 7 days a week doing this. It is hard during the investigations. They have to have cooperation from the case in order to do their contact tracing and investigation. Keep in mind that the person might be really sick at the time. A lot of times they might be angry or scared, so they're going through a lot. They just got this COVID diagnosis, and then we're calling them and asking them a million questions. So the investigations are time consuming, but we are doing our best to do the investigations so we can stop the spread. So some of the questions we ask, it's not only who they had contact with, but it's a lot of context. So, were they symptomatic at the time? What was the context or setting they're in? Were they wearing masks? Like what was the activity you guys were doing? So all of this factors into what we determine is a close contact and who would need to be quarantined. So sometimes, the investigation can last a few days. Some people that maybe were active and going out a lot, it takes a while for them to relay information back to us, you know, of all the places or people they may have had come into contact with. And again, they're sick, they're not feeling well. So, you know, our investigators are constantly working with these cases, trying to stop the spread of it. Just another note about confidentiality, like I mentioned, that our investigators only disclose what's necessary. I get asked this every day, you know, why aren't we saying the person's name, or why aren't we releasing where they spent time or where they work or where they stayed, what hotel did they stay at, or, you know, what airlines did they fly on? Every day we get these questions. So again, you know, the investigators are trying to build that trust. And if we start putting it all over social media or releasing people's private information, they're not going to trust us. And if they don't trust us to disclose information, we're not going to get very far in our investigation and contact tracing. So, you know, we do take confidentiality very seriously. And again, businesses or companies might have their own protocol for releasing information. That's why you'll see in the media certain businesses or companies announce it, but that's up to them. At Maui Department of Health, we would not release anything like that unless absolutely necessary. So this is just another graphic of what I just talked about, the whole process of contact tracing from the time we get a case. We isolate and monitor the person. We work to identify their contacts. We quarantine their contacts and monitor them if needed. If any of the contacts develop symptoms, we test them, and they could potentially become a new case. And then, you know, the whole cycle repeats itself. So this is, like I said, what our staff is doing 7 days a week here. Aside from investigations and contact tracing, we're also working hard on trying to plan for isolation and quarantine. So in order for, again, those sick individuals or people that got their diagnosis to comply with our recommendations, we have to support their isolation and quarantine. So, sorry, you guys, okay, thanks. So we need to make sure they can safely, whether it's isolation because they're known case or quarantine because we're monitoring them, we want to make sure they feel safe and comfortable, that they have the services they need. So, you know, there's a lot of different grocery delivery services, medication delivery services, those kind of things. And we are also actively monitoring people and supporting them. So our monitors are calling people 1 or 2 times a day, checking in not only on their symptoms, but that they have what they need, because we want them to comply with the quarantine or isolation, right? And we don't want to threaten them, you know, with anything. We want to support them and help them do this. So that's what we are also working on. So that's actually it. You know, I just want to thank again the Lana'i Emergency Preparedness Group Medical Sector, and these are your resources. Everything listed here, and I truly apologize if I forgot anyone, but these are your resources. So again, if you feel sick, if you have concerns, you know, talk to your provider. Don't be afraid to seek help. All of you have a very strong, connected, amazing community there, and I think it's wonderful what the community can do when they come together. So I just want to thank the group for just being so good with communication and working with us and helping us get information out. I know there's a lot of information on social media and different places, but you know, I recommend that you get information from a credible source before you spread that information. So I really want to thank the group. And these are additional resources. So those were your on-island resources. These are additional resources. The hawaiicovid19.com is probably the most updated website right now. If you're interested in the numbers and the stats, and they have the dashboard, you can follow that. Questions about DOE, they put their most current information on the hawaiipublicschools.org. 211 is the statewide hotline. So any general questions about COVID, you can call 211. And like Tess mentioned in the beginning, you know, we have 15 minutes, so we'll take as many questions as we can within the last 15 minutes. But otherwise, please feel free to email your questions to the doh.mauitriage@doh.hawaii.gov. So if you can't see that, it's doh.mauitriage, TRIAGE, @doh.hawaii.gov. And we have our health educator who is monitoring that email account that will try to respond to all of your questions. So I think that's it on our part. I'll kick it back to Tess for any questions for Dr. Peng or I in the last 15 minutes. Thank you everyone for making the time on this evening to join us and get some information that I hope will benefit the whole community there.
Thank you very much, Doctor, and thank you, Heidi. As we said earlier, we're not going to be doing questions verbally because there are 211 people, so that is going to be difficult. We do have a lot of questions coming off of the chat. Many of them are very specific and probably should be addressed individually. So we're going to take it over to Mrs. Val Janikowski to kind of present some of these questions for Dr. and Heidi.
So one of the questions that was asked more than once was if you can share how many people are quarantined on Lana'i.
I just got asked that question. I actually was told once, but I purposely do not remember what it is. The problem we had in Molokai when there were cases, people kind of ferreted out them and there were death threats against them. If you personally can give me a reason to know, personally, I might answer, but I can tell you, just talking to my epidemiologist, who kind of mentioned in passing, was a whole lot less than a similar situation that we've had on Maui. I heard the Lana'i people are very keep away and hands-offish when it comes to dealing or getting close with outsiders, people off island. And that's probably a good thing in this case because Oahu has lots of cases.
So the next part, if you're without the answer to that question, Doctor, they're also asking if there are specific questions about quarantine or about tracing. Who's monitoring that?
We are.
We have that.
And how, can you explain a little bit about how you're monitoring that? For example, if someone is on Lana'i and supposed to be quarantined, how are they, how is that enforcement done?
I think enforcement, our monitors call everybody that we're actively monitoring, like I said, once or twice a day. So we check in on their symptoms and that they have everything that they need. If you're asking, you know, if people are thinking that we are actively patrolling their residence or knocking on their door to ensure that they're home, we are not doing that. And I understand, you know, some people feel that people will break isolation or quarantine. But again, it's building trust with those people. We try to educate them. Our investigators, you know, are educating and supporting them as much as possible. We have to have their cooperation. You know, we don't threaten them. Maybe some people feel that, you know, but they still have rights, right? These are sick people. They're not in jail. So we're not sending police to their doors to make sure they're actually home when they say they're home. There is a level of trust that I think goes both ways when we check in. And I know there's been cases, again, in the media or, you know, where people are reporting that so-and-so was breaking isolation, and we'll try to we do deal with those as best as we can. But in general, you know, we don't I don't know what the right word is, but we're not, even the cases on Maui, so the people quarantining on your island are not being treated any differently. Like the cases on Maui, we are not doing home visits and ensuring they're there.
We got in trouble before when we got the index case and we asked them to name the contacts, and then the contacts were not treated well. Word got out, and sometimes the index cases would just clam up. I heard how you treat my friends. Don't talk to me. Goodbye. So we are not trying to drive this whole thing underground. It's not worth it.
Okay, and then there are so many questions that are specific to individuals versus the group at large, but a lot of the questions are more about the specific cases, and I'm just passing along what I've tried to read here. They're asking about if there's any way that the particulars can be addressed about how they know they have not come in contact with somebody that's positive. I know, I understand that's almost impossible to answer, but if you could address that in a way.
Sure. So the investigations that are going on, they are calling people that, again, part of their investigation. So people that were in prolonged contact. So that's within 6 feet or more for 15 minutes or longer is kind of their criteria. But again, it's the context, right? Were they outdoors? Were they in a small enclosed space? So all of that. But our investigators are calling or have been calling this whole week, getting more information about those contacts. So I do know that majority of the close contacts were not on your island because of the policy that was in place. So, you know, from the work site going back to the residence and getting meals and whatnot delivered to wherever they were staying. A lot of the contacts are other family members that are either on Maui or Oahu at this point. So again, you would have been called if you were determined to be a close contact. If you were not called and you think you were, it doesn't change the recommendations that we just went over. You know, Dr. Pang's 5 Ws, like whether you know if you're a known contact or not, monitor your health, you know, do all the precautions that we're talking about. And the first sign of you not feeling well or some sort of symptoms, talk to your medical provider. I understand the fear, definitely, but there's also the risk of being somewhere and you're next to somebody for 10 minutes in another setting that you don't know their COVID status. So I know how the fear can build up, and you can be so worried that you had contact with that person, especially because you know they were in your community. But at the same time, it could happen anywhere, and we just don't know their COVID status, right? So whether you know about the case or whether the number is 1 or 50, it doesn't change what you should be doing, right? You need to go out in public, get your groceries, go to work, do what you need to do. You need to do those things every day to live your life. And like I said, there's no 100% guarantee that you won't ever get it, but just follow those recommendations. I know some people aren't happy with that, but that's the best we got right now, you know. Wearing the mask, frequent hand washing, don't being around people when you're sick. So I know people want to know exactly where they went, but really, like truly, people don't need to know. Like, you know, me going to the grocery store and I'm waiting in line to pay is already a risk, and that's some of the risk that some of these contacts, you know, that minimal risk. So all I can say is just monitor your health. And know that we have called people and got more information. We've been working on this this whole week.
You should know that for every case that we know about, let's just say there were 2 visitors from Oahu, and 1 test is pending. There are, we think, 7 to 10 really there that we don't know about. So if you're going to say, well, we had 2 visitors on this Oahu group, well, you mean to tell me they're like times 10, 20 visitors in the same kind of setting, groups coming from Oahu? Yeah, I guess so. LA, outside LA County, was 44 to 1. and the most conservative is 5-to-1. So like everybody's probably infected, or not everybody, but a lot of people asymptomatic. That's all we can do is just kind of be cautious because everybody might be shedding.
So Dr. Pang, is there if you're gonna clarify when you're looking at a dense location of travel, so you have this small city where everything's on top of each other, and that's where everybody is at, not everybody, but I mean, that's where the concentration of the activity is. Does that make people, or should people be more concerned about that? And can that not explain some of the fears that people are having because they're all together and everybody's in the same place?
Okay, I think in a city setting, the spread is really like 10 feet. So it's not like on the air and drifting atomic contamination. So it really is within the city. In the cities, you can kind of have your little micro units. You can be safe in the city. My daughter's in Honolulu. She kind of stays at home when she can. It's people have a personal life, they have a working life, then they have a recreational life where they go out with their friends and families. You could be very behaved at work because your boss and the setup is well behaved. You can be pretty good with your family because you care about them the most. But when you go out with your friends and you do these massive flotillas and you think you're all spread out because you're at the beach, because you keep looking up and you look around you and there's people all around you, just one little breach can really infect a bunch of people and it could wipe out an entire community.
Yeah, I think that's why so many people are concerned, because it is that's the point. The question was asked, I don't know if you can answer it, but who are the tracers? Are there tracers on Lana'i? Is there public health nursing representation on Lana'i?
Okay, yes. So Maui District Health Office, we have about 20 or so investigators trained. So we have our 2 epi specialists, and the majority of them are public health nurses. We also have some staff of some of our other programs here. So they've all been trained. Yes, we do have contact tracers on your island. We did a training. We are using our Medical Reserve Corps volunteer group. So they have been trained in doing the monitoring, not necessarily the investigations. So again, contact tracing is a general term. We sort of broke it up into the investigators doing the bulk of the interviewing and investigations, and then any contacts they identify, they notify the contacts, and then when it can be kicked to the monitoring, we have volunteers helping with that as well. So yes, we do have currently right now we have our 1 district health office staff, Lana'i. She is on island, and we are supporting her as best as we can. And the rest, like I said, majority of contact tracing is done over the phone anyways. It's not done via home visits or in person. So a lot of this work can be done remotely. So did I answer the question, like who exactly is doing it? I hope I answered that question. Our staff and volunteers.
Yeah, and I know folks are still trying to train. I know there's a lot. So there was a question about test availability, and right now there's a bunch of questions coming through, so it's difficult to keep up. So, and I know we're going to be out of time soon, but there's a question about people having testing availability. Are there tests available? There was another question if your slides would be available.
Yes, I can email the slides to this group right here. I'll email it to you, and then you guys can distribute it how you want. As far as testing, I would talk to your provider on island. You know, again, if you guys feel like there needs to be a community-wide drive-through testing like you guys did a couple months ago, we can support you in whatever you need. On Maui, when we had the recent outbreak, we had our Minute Medical, one of our clinics, set up some community-wide testing. Prior to that, we used Premier Medical Group came in and did community-wide testing. So, but like I said, you guys have a great network there. So talk to everyone should speak to their personal primary care provider first, and then as needed, we will definitely support you if you want it on a bigger scale or what the need is.
Okay, and then there's one question that's been asked. There's a couple of questions that have been asked more than once. I'm doing my best here, but one of them is if you can explain layering in regards to exposure.
What?
It's layering.
Explain layering in regards to exposure. Sorry.
I don't know what that term is, layering.
Me neither.
Okay, and neither do I. That's why I wanted to make sure. I apologize. I saw it twice, but there's a bunch popping in right now. So with these questions, is there a way that we can specifically make sure that they get followed up on through this email, the DOH and Maui Triage? Or is it going to be a bulk of them?
The written questions.
Yeah, I would say email it to the email that I'm showing up right now, doh.mauitriage@doh.hawaii.gov. And again, individually, if you have risk factors that you're worried about, something about your health condition that we don't know about, talk to your primary care provider. And they can also advise you as best as they can.
You know, I have to admit, once Maui shut down travel from the mainland, like mainland people coming to Maui, that stopped a lot of the cases. But then we had a lot of Maui residents who went to the mainland who returned to Maui infected. I suspect with the high rates on Oahu, you will see that also. Yes, there are people coming from Oahu, Oahu residents working on Lana'i, but you have a lot of Lana'i people going to Oahu who will come back to Lana'i exposed and infected. It works both ways. Anybody who contacts outside of Lana'i bears that kind of infection rate. And right now, Oahu is pretty high, right? So that's why Oahu workers coming to Lana'i came infected. What do you think a Lana'i person going to Oahu is exposed to, right? So keep your guard up, because it's kind of not where you live, but where you visited.
And last question, Dr. Ping, are you able to clarify that? Did you say that there's 2 visitors from Oahu that tested positive and 1 test is pending? Did you say that or no?
Yeah, that's the last I heard. There are 2 positive and 1 pending.
I could still keep trying to read these. It is 7 o'clock. Tess, I think it might be good to address these questions.
Okay.
Some of them individually through that email. If you want me to keep reading them, I can. There's a lot that are not going to be answered from you guys. There's a lot of questions that people want answered through Pu'ulama Lanai, and specifically about the circumstances and about the exposure and risks of exposure in the future with people traveling to Lanai. Are you able to address that in any way?
Are we talking about the travel restrictions or monitoring at airports and ferries?
I could guess through the questions I've been able to pop and see all of the above.
Sorry, Mel. Okay.
Okay.
Yeah, well, I guess regarding Pu'ulama Lanai, they have been amazing in collaborating, communicating, helping us with whatever we need. I think they have done an excellent job in putting protocols in place, even prior to this happening, and just continuing to work with us and help us. So they have been amazing. As far as the travel quarantines or restrictions or protocols in place to screen people coming in, that's beyond my level. That's governor, mayor, Department of Transportation. So if you're asking about specifics of people being screened, entering and leaving the ferries or the airports, I think that's being discussed at the state level.
Yeah. People leaving Oahu, Kauai Big Island, Maui, are supposed to be screened when they leave. And I guess, you know, this guy, he got through the screening. The screening's not terrific. I mean, they screen you for fever, but not everybody has fever. And they certainly might not have it at the time they're shedding. And then they ask you about your symptoms. And a person can say, well, not really, but of course he's not feeling perfect, but he's part of the team and the team depends on him coming. And so there's kind of a lot of loose things that go through this departure screening as they depart Oahu, wherever they go, including Lana'i, right?
So the Maui County website has the best place for county-specific information. So if you go to the county website, there's all of the mayor's mandates and declarations and things like that regarding travel and what the mayors are trying to do. Safetravels.gov is another website, but that's more for inner island or trans-Pacific travel. But yeah, some of those questions, you know, if you email that to that Maui triage, yeah, our health educator will do our best to direct you to where you can get those answers. But like I said, some of that is not Department of Health. Like, it's beyond our control. It's a collaboration between all state agencies, and a lot of it, you know, on Oahu at the highest, at the governor's level. And the head of, you know, Department of Transportation, like I mentioned, Hawaii Tourism Authority, those things. I know the harbors are state property, but the Lanai Ferry is run by a private company. So there's a lot of players involved, I guess. So we will try our best to answer questions that you send to that email, but it might just be redirecting you somewhere else. So don't get too frustrated, but we don't have control over all of that.
Yeah. And I guess, Heidi, I know you guys are doing a lot of work. I know there's a lot that goes into it that people don't know, and that's why it's good to have these informative meetings. I do think that there is a repetitive theme that I keep seeing you know, as I can see parts of this, is that people are asking if specific things can be addressed in the future. So maybe we can, by Pulama, they're asking for transparency. That's something that's a repetitive thing. I know that doesn't have to do with the Department of Health. And I don't kill the messenger. I'm just passing on, you know, people are just concerned. They want to make sure that things are in place, and that there's another comment that is there a way that we can ensure that another person doesn't, the same thing doesn't occur, if there's a way that we can make sure that things are in place. I honestly want to say myself that I think that the fear of the unknown is part of a lot of these comments, but that's my opinion. And the person that was sick is a sick person. So that's just my 2 cents. You know, they're ill. So they're not trying to be mean, and I don't think somebody's trying to expose the community intentionally, but you know, that's just my opinion. So Tess, do you want to keep going, or are you people are thanking people and asking some of the same questions again.
I do know that respecting everyone's time, we do have to start closing this meeting down. Do appreciate all of you being here. I know, looking at the comments, this session may not be what you expected or hoped for, and many of the questions are very specific. So please do use the resources provided to you in the chat, as well as the email at the bottom. We're also available to you for questions if you have any. I want to thank Val Janikowski for going through all of the messages and trying to gather them as best she could to present to Dr. and Heidi. We will look at trying to do more in the future. I want to thank Dr. Pang for being here, Heidi for being here, for your dedication, both of you, to doing your best for our island. Do you have any closing remarks, Dr. Pang or Heidi?
We're having kind of a crisis here, balancing the economy and the safety of the community. It's going to be a very, very tough thing to do. All I can do is pray for the vaccine by December 31st.
And I just want to say that I know it's scary. I know it's frustrating. The unknowns, the bureaucracy, there's so much frustration out there. But really what I tell a lot of people that call me is we only have control of ourselves, you know, and I know that's not a good enough answer for some people, but we can only control our own actions. And that's why what Dr. Pang focuses on is the 5 W's. It's positive, concrete actions that you can do yourself, not depending on somebody else to put regulations in place or depending on the state to stop travel or, you know, I get it. I understand the fear and frustration. I go through the cycles myself as a parent, as a, you know, community member. But the bottom line is this: we're all facing something we've never had before, and we can only control our actions. And we need to not be so quick to blame other people. You know, talking about the stigma and, you know, people are sick, they didn't ask for it. So all we can, and again, we shouldn't be judging other people, what choices they're making. My threshold and what choices I would make might be different from somebody that has medical risk factors or other things. Like, we all have different levels of comfort, different situations, personal lives. So we just need to not judge each other, not point fingers, not blame, not expect the government or not expect somebody to fix the situation. Just we're all trying our best, and everybody needs to, I feel personally, should focus on what they can do as themselves. And if everybody just does a little bit, I think we'll be in a better place as a whole. So thank you, everyone. I'm sorry if we couldn't get to all your questions. Please email, and we'll do our best to get to them. And then we will support you guys as best as we can. If you decide to do another community session, if you want to do community testing, whatever you think you want, we will do our best to support you with resources or information to get that out there. So thank you, everyone.
Thank you to all of you for attending this meeting this evening. Please keep each other safe. Good night.